So today we're going to talk about what Medicare is, a couple nuances with Medicare, like a late enrollment penalty, and then the extra plans that people might or might not know about when it comes to Medicare. So I wanted to start today's video by basically talking about what Medicare is. So Medicare is a federally funded health insurance program for people over the age of 65 and also for people who are disabled and deemed disabled by Social Security for 25 consecutive months. Because I know I've ran into people who aren't 65 that have Medicare.
Correct.
And it's an unfortunate situation in which they have it, but they do have it. So it's important for them to know about this too. And
It's been a lifesaver for them.
absolutely. Yeah, Medicare is a great program. And, it's for people over the age of 65 and for people 25 consecutive months. But there are a couple different things that people need to know about it when it comes to enrolling into it. And we want to talk about the price of Medicare first off, and then a couple other things attached to that too. So, a couple different parts of Medicare, and feel free to chime in whenever you want.
Sure.
Part A is the hospital side of Medicare. Okay? So, I think about it like the four walls around us right here. Basically, it's like the room and board of the hospital, right? And to get Medicare Part A, for free, that is, you or your spouse have had to have worked 40 quarters and paid Medicare payroll taxes to qualify for premium free Part A, right? There are costs associated with it depending on how many quarters you worked. If you didn't work the 40 quarters, which is 10 years, 4 quarters in a year, and basically most people get premium free Part A, right? And you get that when you turn 65. And then there's Part B, as in boy. Part B is like the medical side or the doctor side of Medicare. And that is basically outpatient things, that is preventive care, that's your doctors, that's durable medical equipment, and a few other things part of that as well. Home health care could be billed as. And Part B has a standard premium, which goes up every single year, it seems like, of $185.
Right.
So basically, those two parts of Medicare are necessary for almost everybody. And do you want to talk about?
I call that the base. Like that's your base. You must have that in order to get any care, or B, to complete your care. So A and B will get you hospital care and doctor care, but it's not great, right? There's lots of deductibles, there's lots of loopholes, and you're not, there's no cap on your expenses like there is on individual care.
Right.
So there are ways that we can supplement that. But before we even get there, A and B is what we call original Medicare.
Yep.
Your base that you must, that's the bare minimum.
Yep.
The bare minimum.
Right. Yep. So that's the bare minimum for sure. And then, so people know with traditional or original Medicare Part A and Part B by itself, it's not network driven because it's federally funded. So when you have a private insurance company that is overseeing you and you basically are allowing them to be the main administrator of your Medicare benefits, you play by their rules. These are private insurance companies. If you keep Part A and Part B by itself, it's not network driven. You don't have to play by the insurance company's rules. So that means that you could see any doctor, any hospital, any facility that participates in Medicare assignment.
Correct.
Right? So if they take Medicare, right, then you're good to see that doctor. So with that being said, if there's no networks, there's no referrals, getting access to other specialists from your primary care, right? And there are very limited prior authorizations as well, right? Because you're not under the oversight of that private insurance company. Right. I always tell my clients that if you decide to go, which we're going to touch into, with a Part C Medicare Advantage plan, right, you are basically signing up for a company or a plan that a company that offers a plan through Medicare that they regulate you. And they do that because they are publicly traded companies. And what's the goal of a publicly traded company? Well, they're on the New York Stock Exchange. And it's profit. Any goal of a profitable company is to pay back their stakeholders or their investors, their stockholders. So in basically the insurance world, you need to play by their rules because they want to make sure that if you need that surgery, you really need that surgery. Or if you want to see that doctor, they have a contract with the insurance company. So with original Medicare, no referrals, no networks, very limited authorization, which is better for the care of people, in my opinion.
Correct.
So that's Part A and Part B. We know how much it costs, right? Do you want to touch on Part D?
Sure.
Okay.
Sure. So Part D is the prescription portion of Medicare that rounds out your health care, right? So you have your hospital, Part A, your medical, Part B. Now you have your prescriptions written, prescribed from your doctor. So Part D,
Part D is basically, it's a very complicated subject, and it's for another video of why it's so complicated. But Part D is also private insurance companies that have a Medicare prescription plan, and you need to make sure that your Medicare prescription plan covers your drugs, your prescription drugs, as well as making sure you can afford them. And basically, Part A, Part B, and Part D are kind of these standalone areas of Medicare, where you have options for your healthcare with Part A, Part B, and Part D. And I always tell my clients, we talked about Part A, Part B, and Part D, the necessary requirements for Medicare if you don't want a penalty, which we'll get into next. But we didn't talk about Part C, right? That's something that people need to know about. But I first want to talk about the penalties
correct.
of not applying for Medicare in your IEP, your initial enrollment period. Um, so your initial enrollment period is basically a 7-month window of your 65th birthday, which starts 3 months before your birth month, and 3 months after your birth month, in which you could sign up for Medicare Part B, Part A as well. And most people fall and use this enrollment period because they want Medicare at 65.
Correct.
And some people don't use it because they don't want Medicare at 65. Medicare is a great program. It really is. And it's different from area to area
It's
on
more
how.
complete coverage than your general individual plans.
Right, definitely. And you got to hope so because you paid taxes into it your whole life,
Right.
right? You're hoping to collect a Social Security check after you've been paying FICA your whole entire life. But with that being said, if you're working for an employer with more than 20 active employees, and you're on the insurance through you or your spouse's, employment, you don't have to take Medicare Part B or Part A or Part C or Part D, as long, right, as you or your spouse are working for an employer and receiving health care coverage from that employer with more than 20 active employees.
Right.
Right? If you have less than 20 active employees in your organization, you need to take Medicare and have that as your primary insurance.
Correct.
And if you don't do that, right, if you decide to keep your work insurance, that's fine. There are a couple forms from Social Security that you need to fill out, and that go ahead and let Social Security know, who administers Medicare, that you did have credible coverage from the day you turn 65 until the day that you want Medicare. That way you avoid the penalties. But if you're not in that situation and you miss your IEP, then you're looking at a premium, which is a lifetime premium of 10% of the premium of Part B for every full 12-month period that you didn't sign up for Part B but could have. And Part D has a 1% penalty for the national average of premium, which is around $35 in 2025, for every single month that you could have had Part D but did not have Part D. You could have had Part D if you had either Part A and or Part B. Okay? So if you
So
have.
why is this, Ethan? Because the government wants you insured.
Right.
Whether it's through your employer or through Medicare, but you need credible coverage.
Absolutely.
Full major medical.
Right? And it's very important that people understand their IEP. You need to sign up for Part A and Part B if you're in the situation where your spouse's employment or your employment has less than 20 active employees. That's really the only true way to avoid the lifetime penalty.
Right.
A couple nuances, but that really is the true primary way of avoiding the penalty.
Now, if you're not sure, you just reach out to any credible agent.
Yes.
will inform you. They'll look at your situation and inform you. Yes, you need to apply. No, you do not need to apply. You may want to, but you don't need to.
Sure. Yeah. And you definitely find someone you trust. We talked about that in our last podcast too. It's so important to find someone that you trust. Find a broker that you can trust. It's super important that you do that. But with all that being said as well, we talked about Part A, Part B, and Part D. We talked about the late enrollment penalty, but we definitely skipped over Part C.
Okay.
And
I can talk a little
We
bit.
have the expert on the
Yeah.
podcast, so I think we should ask the expert.
Right.
What's your insight on Part C? What is it? How does it work? How does someone find the best plan for them?
Right. So Part C, I like to say it's an umbrella, right? It's like an umbrella that encloses and covers you with your Part A, your Part B, and your Part D.
Mhm.
So you're not missing any of the basics that you need, right? So a Part C company, a Medicare Advantage plan, is basically saying to you, work with me. You come onto our plan, use our networks,
Mhm.
right? Go for your approvals through us.
Yep.
We will throw you some perks. We will make sure that you get some extra benefits that Medicare does not cover, like some dental, some nice gym membership to keep you healthy, right? It's all
Mhm.
about being healthy,
Right.
preventive. But with a Medicare Advantage, you need to stay in a network. Now,
Right.
yes, you can go out of network on some of your PPOs, but that doctor or that facility needs to say, yes, we will accept it out of network.
Right. Of
Okay.
course.
And the Medicare Advantage plans have both HMOs and PPOs, and some variations thereof, but those are the main.
Yes.
And the best way to know is to sit with a trusted agent
Mhm.
that is independent, right? So it's not just one Medicare plan. They do most of the Medicare plans, the
Right.
major players, and they'll sit there like we'll take your information. We'll ask for your doctors. We'll ask for your medications, right? We'll ask, and that will kind of let us know if there's any kind of chronic illness going on because there are special plans that
Yeah.
gear towards that and really,
Absolutely.
really do a lot to help. It's all about helping the member.
Mhm.
So we'll sit down with you. We'll go over. Do you travel? Do you stay mainly in your home base? You know, things like that that affect how you get your coverage. How you
Yeah.
get your if you go to Kentucky 4 months out of the year, you need to be able to see a doctor out there if you're sick.
Yes.
So these are all things that are important. And we, in our conversation, in our friendly just conversation, getting to know one another, the agent discovers this and is able to decipher which plans, give you some nice, a pretty option,
Yeah.
pretty picture of your situation and how your healthcare lines up.
So true. And then one thing we forgot to touch on, which is why Part C becomes relevant, is how much it costs to have Part A and Part B when you use it, right? It's fee for service, which means you
Mm-hmm.
have fees upon your medical
Mm-hmm.
service, right? So basically, if you have Part A and Part B by itself, there are deductibles, there are co-insurances, there are basically no stop loss when it comes to that. There's no limit of how much you could spend.
Mm-hmm.
For example, the Part A deductible is roughly $1,600 in 2025 and some change. Part B has a $257 deductible, in which you can incur whether it be some outpatient surgery, preventive care, which is usually free under Medicare, which is excellent. Whether it be a doctor's office visit,
An
blood work,
MRI, yeah.
MRI, anything outpatient. And after your 257 deductible, you're now paying 20% of the Medicare approved amount. So just like any contract, you could submit a bill to me. I could tell you, hey, Dani, we have a contract. I don't, based upon our contract, you couldn't have billed me that much and it's not going to work. So you cut down that bill by X amount of money, which is
Right.
our contract. Medicare will pay 80% of
Mm-hmm.
that approved amount, leaving the beneficiary with the 20% responsibility for Part B services, right? So if you decide to go with a Medicare Advantage plan, aka Part C, they cover what Medicare covers, but with a twist. They make you use their network, right? You must get your prescriptions filled, which means they must be covered by the plan.
Mm-hmm.
And then you have to follow their rules, authorizations, referrals if they're required, etc. You play by their rule and their playbook. If you keep original Medicare, Part A and Part B, you have the option to purchase what's called a Medigap or a Medicare supplement plan, which basically is legally binded to pay what Medicare leaves you with in accordance to how the plan works. And there's so many different plans. We have Plan F for people that turn 65 before January 1st, 2020. We have Plan G, which is for anybody and everybody who has Medicare. There are high deductible versions of that. There's a Plan N, and you need to know when the best time to sign up for that is, which is Medigap Open Enrollment, which is 6 months basically after you get your Medicare Part B to sign up for a Medigap plan with open enrollment, it's called. And the reason that's so important is because they scrutinize you based upon your health if you miss that window. So if you're the type of person who likes to travel, you want ease of mind, peaceful coverage, go where you want to go, you definitely probably want to look at a supplement plan. They do have an additional premium attached, but you do pay for what you get.
Right.
Nothing wrong with Medicare Advantage. So many people say Medicare Advantage is bad. There's nothing wrong with them. You and I both have many clients on it.
Yes.
Most of the time, we see $0 premiums, at least where we live in South
Right.
Florida. It does vary all across the nation. We see premiums in different states for it. But with that being said, those are your two options for coverage. Traditional Medicare or original Medicare by itself is one way. We don't suggest that because you have no limit.
Right.
You either have a supplement plan, right, which still gives you that nationwide, no referral, no network, no authorizations. You just have a separate and private insurance company that is going to basically pick up what Medicare leaves you with in accordance with how it's built. And then there are Medicare Advantage plans, which give you a limit of your max amount of pocket. Something happens to you, you have a limit, which is great.
Yes, that's very important.
And then you have copays. The plan says, hey, if you want to see a specialist, it's this much money, which is a copay at the time of service. So I think that's a great introduction to Medicare, kind of what it is a little bit. It's really important that people know about their enrollment periods. So I want you to briefly touch on the enrollment periods besides the initial ones we talked about. What are the general enrollment periods for people that have Medicare?
Right. So if you're already on Medicare, you have chances or opportunities to change your plan, right? So that would be the open enrollment period. Is it annual enrollment period is October 15th through December 7th. That's your first option, right? So that's when you're going to see what all the new plans look like for next year, to see if there might be something that's that you think is more attractive than what you already have, or your plan might be looking fantastic. So that will help you ease of mind if you should be staying or going. So that's your first time. You have October 15th through December 7th. Then you have another period called the open enrollment period.
For Medicare Advantage.
Right, which is January 1 through March 31. Now, during that period, you have the chance to change your insurance, right? So now if you went on a plan, a Medicare Advantage plan, back the year prior, or even 5 years prior, this would be a chance. You'd have a chance to make a change. It could be a buyer's remorse, or it could just be you want to change your plan. Now, if you have a supplement, you cannot make a change at that time. So you can change your supplement anytime during the year. So if you want to change to another supplement, or within your supplement, you can do that as long as you pass medical questions if it pertains, which generally it does. There are some loopholes, but generally it pertains. So you're able to change. You're able to change your supplement. The issue at hand is you cannot change your drug plan, your Part D plan at that time. That has to be done the year prior, between October and December.
Right.
So if you're on a Medicare Advantage plan and you decide that you want to go onto a supplement during that January through March period, yes, you would technically be able to go onto the supplement if you passed the medical underwriting. But would you be able to get onto a prescription plan?
Yes, absolutely. So you can do so. What you can't do is have a prescription drug plan and opt in to do an Advantage plan. Okay. So the Medicare Advantage open enrollment period, like you said, is January through March 31st, right? So Medicare Advantage is first there. You need to have Medicare Advantage. And you made a really good point too, is that you can change supplements throughout the year, right? There are requirements. You have to pass medical underwriting, right? They search the medical database, and you're answering questions, talking to your broker or whoever it may be, and you're telling the broker, no, I didn't go in the hospital the last 2 years. Well, the insurance company is looking at you like, great, thank you so much for telling us that. Now we're going to actually pull the data and see if you lied to us, right? So I always tell my clients, hey, don't lie to me, because if it were up to me, I'd snap my fingers and make it happen for you.
Exactly. We want the best for you.
But we're the middleman. We're between you and the insurance company, right? So you be honest with us, and we'll do our best our best job to you. So I always, tell my clients, the annual election period, annual enrollment period is for anybody and everybody who has Medicare already. Okay.
Mm-hmm.
And Medicare Advantage open enrollment period is for people who have Medicare Advantage. Now, the Medicare Advantage is nice though, because, excuse me, let's say that you went on a Medicare Advantage plan for January 1st, all of a sudden your doctor drops the insurance company,
Mm-hmm.
which happens, or your insurance company dropped your doctor. Guess what? Now you can switch back to the plan you had before or try a new one, but you
Right.
are locked
Correct.
in most situations for the rest of the year.
Correct.
Besides specific special enrollment periods, which is also a whole other video. But
Yes.
this is a real concept for people to understand the foundations, how it works, what it is, and how people can figure out how to enroll in the best plan, which is simply put, to find one that covers your doctors and your prescriptions
Mm-hmm.
in accordance with how you want it to be built. Because in my opinion, the extra is the extra. You don't choose something based
Correct.
upon the extra.
Absolutely.
Because if you're an insurance company and you're getting scrutinized, or you're under, let's say, pressure from the government,
Uh-huh.
right? And you need to pull something away because your funding has changed. What are you
Uh-huh.
taking away first?
Exactly. The perks.
The perks. So
Yes.
choose something that makes you feel comfortable. The perks are the perks, and that's great. But you choose the core foundation of something, and the extra is great, but it's extra. Is there anything else you want to touch
Yeah,
upon?
so I'd like to say that I think it's important that people understand. So it's very confusing, right?
Right.
So my mom turned 65. There was, oh my God, the amount of mail, the amount of phone calls, the amount of television, um, because her
Commercials.
birthday's in September. So the amount of commercials
Oh.
that were out there. So she was inundated. And myself trying to help her, it can be very daunting.
Mhm.
So it's really important to sit down with someone that's independent, right? There's so many independent agents today, but it's very good to sit down with someone that's independent, that you can throw all that mail away. You don't have to answer any of those phone calls. They know everything that's out there.
Right.
They know what you qualify for, what's better. You may not even know that there's something geared towards specifically towards you. And there's no cost, right? So it's included. The government wants you to be on the proper plan and get the care that you need. So they compensate the agents, not you're not paying for that service. So it's costs you absolutely nothing to sit there and just get everything sorted out for you.
So
Nice
true.
and simple.
Yeah, that's a very good point. It's all about trust at the end of the day. And I was at a health fair this morning, and I was telling everybody, hey, the value is not in the little thing that you take from the desk. It's in the appointment. And by the way, the appointment is completely no cost to you. I make a commission. The commissions on Medicare Advantage are the same. They're legally mandated to be the same from company to company, or else it could create steering, which is highly illegal.
Right.
And I tell them, listen, we have no skin in the game. What's best for you is best for us, because first off, we appreciate our clients, and we do better whenever you tell more people about us, which means we want to make you happy. So let's make you happy. Let's find the best plan. And if you're calling a 1-800 number, or you're looking at it, or you're going to call someone you don't know, or at least, it's not a referral, you're better off talking to friends and family about who they've used. You're better off finding someone reliable. Someone from our agency is happy to help. We're licensed in everywhere almost. So, it's about finding someone you trust no matter who that is. But I think that's a good start point into Medicare and what it is. Anything else you want to talk about before?
No, I think we've covered everything.
I think so. There's probably something we missed, but that's okay.
Right. Well, there's always another video for that. This is like the base.
That is the base. Let's not confuse everybody just yet. That's for another video.
That's another reason to have a good relationship, right? Because there really is a lot in this whole Medicare world, right? There's so many rules, so many windows, so many different employment SCPs, special enrollment periods, and all that good stuff, that you might have a situation come up, and you might be thinking, well, I missed that open enrollment period of January through March, so I'm screwed. I have to just stay. But if you just reach out to your trusted confidant, your agent, guess what?
Maybe you're not screwed.
Right.
Maybe.
There might be some loophole that you're just not privy to, you're not aware of.
Right.
And we're always looking to try to make sure we want people happy, right? Because the happier you are, the less complaining we hear.
Right.
So we want everyone
to be happy.
Right.
That's our goal. We make money and we help people. So helping people's first, we make money second. There's no better job There's no better way to get paid than helping people. So I'm grateful to be in this business. And
I feel like I'm making a difference
yeah,
in
me
people's
too.
lives.
Me too.
Yep.
Definitely. It's people's healthcare,
Yeah.
People have families, people love them. So
Yeah.
feels like we're definitely helping as many people as we can. And I love doing that. Hopefully it's help more people too. All right, everybody. Thanks for watching this video. Again, it's Let's Talk Insurance with Ethan and our lovely Dani right here next to me. And I want to let you know, this is the best agency, absolute best insurance. It's who we're sponsored by. So if you're confused or need help with something, please call us. We're happy to help. And we'll see you guys in the next video.